Hi and welcome to another video from Crack the Boards. In today's video, we will focus on pharmacology questions. Let's have a look at the first question. A 55-year-old man with Philadelphia chromosome positive chronic myelogenous leukemia experienced disease progression despite undergoing treatment with interferon alpha and high-dose chemotherapy. Which of the following medications, known as a tyrosine kinase inhibitor, would be a suitable treatment option for this patient? A. Busulfan. B. Epoetin alpha. C. Filgrastim. D. Imatinib. E. Sergramustim. Here the correct answer would be D, imatinib. And this is because imatinib is a tyrosine kinase inhibitor. It specifically binds to the BCR-ABL protein, blocking its ability to transfer phosphate groups to other molecules. To highlight the mechanism, on the left side of the diagram, you see the active BCR-ABL using ATP to phosphorylate substrates, which drives the CML progression. On the right side of the diagram, imatinib binds to the protein, preventing ATP binding and deactivating the kinase. This stops the cancer cells in their tracks. Let's have a look at why the other options are incorrect. Option A is incorrect because busulfan is a bifunctional alkylating agent historically used in CML. While it helps control symptoms like leukocytosis and splenomegaly, it only offers transient improvements and does not target the underlying molecular driver of the disease, which is the BCR-ABL. Option B is incorrect because epoetin alpha is a recombinant form of erythropoietin and is used to treat anemia in conditions like chronic kidney disease or chemotherapy-induced anemia, and it has no role in targeting leukemia itself. Option C is incorrect because filgrastim is a granulocyte colony stimulating factor which reduces neutropenia and infection risk during chemotherapy, but it doesn't address the BCR-ABL fusion protein, which is central to CML. And option E, sergramustim, it's a granulocyte macrophage colony stimulating factor. It supports the immune cell recovery in patients undergoing chemotherapy, but like filgrastim, it doesn't inhibit the specific tyrosine kinase driving the CML. Let's have a look at the second question. A 30-year-old woman presenting with symptoms of upper respiratory tract infection is treated with a medication that leads to pupil dilation without impacting the ability to focus on near objects. Which of the following is most likely responsible for these effects? A. Acetaminophen. B. Amantadine. C. Dextromethorphan. D. Diphenhydramine. E. Pseudoephedrine. The correct option in this question would be E. Pseudoephedrine, as it's an alpha-1 adrenergic receptor agonist. It causes contraction of the radial smooth muscle in the iris, leading to mydriasis, which is pupil dilation. On the other hand, accommodation, which is the ability to focus on near objects, it involves the ciliary muscle, which is controlled by the parasympathetic input via muscarinic receptors. Since pseudoephedrine acts only on the alpha-1 adrenergic receptors and not on muscarinic receptors, it does not affect accommodation. This answer is correct because it's consistent with the patient's presentation. Let's have a look at why the other options are incorrect. Option A is incorrect because acetaminophen is an analgesic and antipyretic with no significant effects on the eye or the autonomic nervous system. Option B is incorrect because amantadine is an antiviral drug and has antimuscarinic activity, which means it blocks muscarinic receptors. This would lead to mydriasis with cycloplasia, not mydriasis alone. Cycloplasia occurs because the ciliary muscle controlled by the muscarinic receptors becomes paralyzed, impairing accommodation. Option C is incorrect because dextromethorphan is a non-opioid antitussive commonly used to suppress cough. It has no direct or indirect effect on the eye. Option D is incorrect because diphenhydramine is a histamine H1 receptor antagonist with antimuscarinic activity. Like amantadine, diphenhydramine would block muscarinic receptors, causing mydriasis with cycloplasia due to the paralysis of the ciliary muscle. Since this question specifically mentions no effect on accommodation, diphenhydramine will not be the correct answer. This marks today's set of questions. Thank you for watching.